In high school, thought I wanted to be a doctor. I wanted to be a sports doctor. I was very into playing sports and got hurt a few times and just really thought the orthopedic job was really cool. Mm-hmm. And so particularly the sports medicine kind of specialist. So I had that in the back of my mind for a while. And then in college, did like the pre-medical track. And then went to medical school, got into med school in Philly. Went there for 4 years and then applied to orthopedic residency, which I did called the Hospital for Special Surgery, which is part of Cornell University in New York City.
Okay.
So I was there for 6 years. I did an extra year of research. And then in my final year is when my wife got pregnant with our first. And then we went to Seattle for a 1-year fellowship, kind of the final year of training. And then you're kind of done and you're ready to look for a job in the world. So my first job was at Washington University in St. Louis. It was a really great opportunity in my field. And so we lived in St. Louis for about 7 years. And then, I had been building up an academic career with publications and speaking engagements around the country and things like that. And I got a few people who knocked on the door, like we're looking for a division chief kind of position, if you're interested in making a move. And we love living in St. Louis. We had no kind of plans to leave, but among the people I was talking to was Stanford. And I had some connections here. I knew that our chairman was previously at Washington University as well. And so there were a few connections. Anyway, I looked at a few places, including USC in Southern California.
Okay.
And New York City, but really loved everything about Stanford, the faculty, the energy, the innovation culture. It's a pretty special thing. So,
what's your current role?
Yes, I'm division chief of the orthopedic trauma service.
Okay,
exactly, and one of the vice chairs of clinical operations.
Okay, excellent. And then I also saw you're a professor as well at the medical school. Is that correct?
Yeah. So professor, within an orthopedic department that's in an academic affiliated with a medical school.
Okay,
it's like an academic department, and so everybody also has kind of separate from your hospital role, you have an academic title through the medical school. So you start out at assistant professor, and then you work your way through and build up your kind of academic reputation, and then you move up to associate professor, and then finally full professor.
So your journey takes you to Stanford, division head in orthopedics here at Stanford Medicine. How do you then transition from your current day-to-day in Stanford Medicine to now exploring your entrepreneurial passions?
Yeah, what? It's funny, of all the career aspirations I've had, I did not have an aspiration to start a company. Like, it's not like I grew up wanting to start a company. And it really is a testament to the culture of Stanford. Everywhere you turn, there's people smarter than you who are talking about new ideas and innovating, and healthcare, particularly now, is just ripe for innovation in so many ways. And so it was about 4 years ago or so, talking to a colleague who now is co-founder of mine about, different problems that are out there. And, we identified scoliosis, despite, I'm not a spine surgeon, I'm an orthopedic trauma surgeon. But it became clear through talking to multiple people that scoliosis in particular was a really huge unmet need from a large group of underserved people who weren't getting diagnosed appropriately, weren't getting diagnosed on time, and weren't getting effective treatment. Anyway, so we identified this major problem out there, and AI was still it was around, but it wasn't like it is today with the large language models. But we saw an opportunity to use AI for some new technology to help at least one component of the scoliosis patient's pathway. And then we just kept iterating on it, talking to more people, just getting slowly more and more excited about some ideas that were crystallizing that we thought we could really transform the system. There's so many little corners of medicine that are stuck in 40 years ago how it was. It's hard to get in to see a specialist. You wait to get an x-ray, all these things that the kind of the standard, the way it's always been done, are really ineffective and inefficient. and expensive. And so we came up with, we think, some really good ways to innovate around delivery of scoliosis care from a digital perspective.
Interesting. Can you tell me a little bit more about the state of scoliosis care, and what are some of the barriers that exist today that kind of maintain or allow the status quo to persist?
Yeah. So, well, it's important to think about scoliosis a little bit in two different buckets. So scoliosis is often thought of as a kid's disease. Many people remember getting screened, in middle school by a gym teacher looking at your back and things. And there's an instrument that can be used to detect or screen for scoliosis. That's kind of what it's known for. But there are far more adults with scoliosis who are having difficulties. So in kids, scoliosis is rarely painful, but the whole name of the game is getting the curve to stop from progressing to a severe level before they're skeletally mature. And that's done with close observation and sometimes bracing, and then sometimes a surgery to hold the spine straight. So that's kind of one component of it. The other is that, it was once thought that if you have a mild curve that stops progressing at skeletal maturity, when you kind of hit puberty and you're 16 or whatever, 14 to 16, depending on your sex, then you go through the rest of your life and you're just fine. There's ample data now. We know that's not true, and scoliosis can progress into adulthood. And so what typically happens, and we've talked to thousands of patients, adult patients with scoliosis now, and it's interesting, we hear a very common thread of these patients' experience. And so what often happens is they start getting back pain in their middle adulthood, say 50s. And, they'll go see their primary care doctor and say, I've got back pain. And they're often told, back pain's common, just go away, it'll get better. And that's very appropriate, unless you have scoliosis as the source of your back pain, in which case it doesn't get better on its own, typically. So people finally get an x-ray. Usually it takes a year or two until the doc says, all right, it hasn't gone away, something else is going on, let's get an x-ray. So then the scoliosis, which is again a curved spine, is seen on the x-ray. And then typically people will get treated with the knee-jerk mainstream medicine reaction, which is a combination of standard physical therapy, medication, sometimes steroid injections, sometimes chiropractic care, et cetera. And so it's interesting, there are a number of high-level studies showing that treatment, that group of treatments has no benefit for patients. So the standard things that we treat scoliosis for without surgery, it really doesn't work. And it's very expensive to insurance companies to pay for it as well. So then people get sent to the scoliosis specialist, who, of course, is a spine surgeon. And there's some data out there that about 6% of people who walk into the door of a spine surgeon end up getting a surgery. And the other 94% are literally told, the good news is you don't need surgery. The bad news is there's not a lot more that we can do for you. Let me say that again. The good news is you don't need surgery. The bad news is there's not a lot much else left to try to treat you with. And so they're often sent to a pain management specialist, given more medications, and kind of told, good luck, And so we've done some internal surveys, and we found that 82% of people feel fully abandoned by the healthcare system. Like they're told, we're done. There's nothing left for you. And so it's a nightmare. They're in pain. They're confused. They literally don't know what to do or where to go. So we saw this huge opportunity to bridge the gap between, the primary care doctor who tries general physical therapy and the surgeon. And, we've kind of developed an effective treatment for scoliosis that's much more affordable, much more effective, and much more accessible for people, particularly doing it from home with digital delivery.
Okay, that's extremely surprising to me that such a collection of treatments and therapies would be so ineffective for, I would think, I guess, a simple pain, but perhaps it's not so simple.
Yeah.
And I'm wondering, what's the source of the pain that scoliosis patients are experiencing?
Yeah. So the exact pain generator is still a bit of a point of controversy. There's a fair number of research going on around that. It's thought, one theory is that, so there's large muscles on each side of the spine. And when it gets curved and twisted, the muscles on one side and the other are unbalanced. And so the fascia is the thick covering of the muscle. And one theory is that the fascia is actually the source of the pain. So on the concavity, or one of the concavities, it can get taut and stiff and tight and be a pain generator. The other thing that happens in adults is the forces that are asymmetric in the spine slowly over time lead to degeneration of the spinal canal. So basically arthritis between the vertebral bodies. And then where there's supposed to be cartilage, just like any arthritis, the cartilage wears away, it becomes bone on bone, and that's the source of pain as well.
I see. And so what are the conditions that a patient needs to be experiencing, or what is it that a surgeon needs to see for one to be a good candidate for surgery, given that 94% of people with scoliosis are not candidates for surgery? Yeah,
that's a great question. The surgical indications are actually relatively narrow because the main definitive surgery for scoliosis is a spinal fusion, where you open the whole back, elevate the muscles, take out the discs between the spine, realign it, and put rods and screws along the whole spine to fuse it to one bone that doesn't bend or twist anymore.
Wow.
So it's a major deal. And so the implications on indications are that, you need to have a curve that's big enough to justify a major surgery. Like if you've got pain and there's not much of a curve, there's no, it doesn't make sense to go in and fuse it together. And then on the flip side, if you've got a curve that's too big to be feasibly treated with surgery, that can be a problem too. And the other main issue is that because it's such a major surgery, you're in the hospital for days, you need to have enough what people term physiologic reserve to undergo that major surgery. So if you're older, if you're frail, if you've got kidney problems, if you've got high blood pressure, et cetera, then the risks are too high for a major surgery. So if you're too kind of sick or have too many medical comorbidities, then you're not a great candidate for surgery either.
That makes a lot of sense. And so given that there's 94% of these patients who are not good candidates for surgery, does that suggest that the average age in the population of patients that are diagnosed with scoliosis is much higher, as we're starting to think about perhaps seniors or the elderly, or are with these middle-aged adults that are experiencing the vast majority of the scoliosis?
Yeah, no, the more severe cases are definitely older people. So the incidence of scoliosis rises as people get older. A recent meta-analysis, a combination of multiple studies, found that 38% of adults over 40 have scoliosis. 68% of adults over 60 have scoliosis.
Wow.
So the older you are, the more likelihood you have it. Now, not everybody with scoliosis has pain. So it's not like all those people are in the same boat with pain. But there's some data that about half of people with scoliosis develop pain at some point in their life. So, it's millions and millions of people who have pain from scoliosis. And again, it's just worse as people get older. Back to your question.
Okay, great. I appreciate that information. And I'm curious as well, what's been the biggest challenge, I guess, for physicians, surgeons, and even insurance companies to find a solution for this population of individuals? Because seeming like we just kind of throw our hands in the air and, wish you luck with pain management doesn't seem to be feasible for any stakeholder involved.
It's not a good solution as it currently stands. The interesting thing, there is a niche type of therapy, not a brand, but a type of physical therapy that is designed specifically for scoliosis. That's very effective for scoliosis. Formed in Germany 90 years ago. It's been around for a while, proven to work. But for a variety of reasons, there are very few in-person practitioners of this type of scoliosis therapy that are available, that are around. There's one estimate is that there's 600 only in the United States. So there's only a handful in the Bay Area. There's a handful in New York City, and there's 2 in San Diego. So it's not feasible to treat these millions of patients with this type of in-person therapy, and it's cash pay only because they're so rare. So this is a little bit of the cornerstone of our solution. Is we built the first of its kind, a kind of modular, personalizable scoliosis specific therapy program that's delivered digitally. And so we actually use our technology, our scanning technology, to really sort out the nuances of the patient's scoliosis, as well as other data points. And we use that to personalize a scoliosis specific therapy program for them. And that's why we're getting great results.
Interesting. Is that a, I guess, self-paced program that, for example, a patient gets an application, you then download the program and you follow it on your own, or is this a combination of in-person but also digital therapy? Yeah,
there's 2 ways we do it. Our pricing right now is customer cash pay, and so there are different tiers of pricing. At the most basic tier, you get pre-recorded videos, and you can do them on your own at your own pace, and people still get reasonable results with that. Some people opt for a more personalized interaction with us, and so we have experts on our team who, again, will personalize a therapy program, but also guide them through more of a concierge, one-on-one, live class kind of interface. So it can be either.
Okay, and if you don't mind, I would love to kind of double tap into the former, which is the patient who does not opt to connect with the community or the physicians or specialists that you provide access to in your product. Can you kind of walk me through what they're experiencing as a part of your treatment plan at the National Scoliosis Clinic?
Yeah, so it's very variable, and we've got over 500 members at this point, and we try to talk to all of our customers, to learn about their experience. And so what we've learned, it's actually pretty variable. There are people who have embraced the lifestyle change of using this program, and so they do it religiously 4 times a week, 30 minutes a time, and they get good results, and they experience that they need to continue with the program and the exercises to maintain the benefits that they've achieved. And then we see the flip side where people, everyone's busy, right? Nowadays, it's hard to fit new things into your schedule and your lifestyle. And so we see people who use it more intermittently, who don't get the sustained kind of really impressive results, without doing it consistently. So a program like this depends on an individual's motivation, their willingness to dive in and do them consistently, because that's how it works best.
I kind of want to walk back a little bit to understand a little bit better how we have, again, this collection of treatments and therapies that have been proven to be suboptimal at best at treating the pain of those who are not good candidates for surgery when it comes to scoliosis. And those are a combination of like in-person therapies, physical therapies, medication, prescription interventions, things of that sort. And I'm curious, given this, I guess it was a German, formerly German originated program that you are now implementing in your plant, why has that not become part of the standard of care when it comes to rehabilitation, pain management, or anything related to any of these scoliosis patients?
Yeah, so that's a great question. We wondered that as well. And, there are a number of barriers to entry to becoming certified for, scoliosis specific exercises or SHRA therapy. It takes a fair bit of time and money to get trained adequately to open that practice. So for many, and it's after standard physical therapy training. So many people who go through and become a physical therapist, they have the choice of going out and working as a therapist and making a good living, or doing additional time, paying additional money to be a scoliosis specific therapist. And there just aren't a lot of financial incentives to do that. It's people who are passionate about scoliosis, but the system hasn't incentivized providers and therapists in particular to become scoliosis specific therapists. And we hope to change that. There is a lack, I think, of understanding and awareness of the scope of this problem. And so that's part of the issue, and we're trying to raise awareness around that as well.
Yeah, that's fascinating to me. It just even the fact that the incentive structure is such that there would have to be a certification by a physical therapist for this particular type of therapy, when in fact now you're proving that a patient can actually go through this program in a self-guided manner and achieve incredible results. You would think that that would be something that would be very easy to integrate into the current rehabilitation framework at the moment.
And that's what we're working hard to do that, and there's a big push in digital health in general to, personalize treatment to patient-specific factors, to bring care to the home instead of in brick-and-mortar healthcare treatment facilities, to give patients access to their own data. And so some of those principles are what's behind our program as well, and really improve the accessibility.
Absolutely. And can you talk a little bit about the latter, where you guys are providing access to data and giving visibility and empowering patients in that regard?
Yeah. So we, the technology component of our software captures a 3-dimensional scan of the person's body and their back on any smartphone. And then we've got an AI algorithm. So the scan goes to the cloud. Our AI algorithm processes the scan and determines very granular components of that patient's anatomy, including posture and some other things. And so these are metrics that patients can follow along regularly to see their progress and to see their body changing. Even if it's just posture, shoulder tilt, there's a lot of asymmetries that scoliosis patients have. So by giving patients, visibility into their own data, it can really increase the engagement, and it really empower patients to take ownership of their disease and the treatment of that.
Excellent. And then when it comes to the scan, is that something that a patient can do alone, or is it something that they may need, for example, a partner to get the proper angle or to have a optimal scan for the software to produce the best results?
Yeah. So the way it works right now is you need another person. So you kind of bend over and touch your toes, and then somebody else walks around you. It takes about 30 seconds to capture the scan. But right now, the way it stands, we don't have a way to do it just solo.
Understood. So when it comes to, I guess, the financial impact of the problem, like you said, one of the problems is that people do not understand the scale of the problem as it relates to scoliosis treatment, And I'm curious about the financial impact, not only to, hospital networks and insurers, but if there is a financial impact to the patient as well. And if you have any information on that you could share.
So right now, the way it works, most of the standard therapies are covered by insurance. And so the main financial impact to the whole system is really on the insurers, the payers. There's good data that's out there on what's spent. There's $47 billion spent a year on fusion surgeries. About $10,000 is spent per patient per year on these non-operative therapies, office visits, x-rays, steroid injections, medications, et cetera. So that financial burden is mainly borne by the payers currently. The problem is patients don't get better. So they're paying for a lot of treatment that isn't helping people. And that's why, when we first launched, our revenue model was cash pay out of pocket, which is obviously not ideal. Nobody wants to pay for their own healthcare. But people do, and they're willing to, because it actually works, and they're desperate for something that is going to help them.
Absolutely. Absolutely. And so I guess you've launched this product. You mentioned you have 500 patients on the platform right now. Can you tell me a little bit about some of these stories that you're getting back from patients who are achieving these incredible results?
Yeah, well, I'll tell you, we have a team that all worked together previously, like a decade ago,
Okay.
and then they went their separate ways, and they reunited here on our team behind this mission. So it really is just an incredibly mission-driven team. And so back to your question is, so the testimonials we get in talking to people are really the highlight of reminding us of why we're doing this. And, being able to just see clearly and hear clearly that we're helping people is what drives all of us to keep doing this. We have, call them office hours, where people come on and share their stories, and we have one of our experts facilitating a discussion. And there are tears on almost every one of these. We hear things like, I didn't know anyone else was going through this. I felt so alone. And just the fact that I'm able to connect with a community is bringing tears to my eyes. And then when it comes to the results, we've heard very briefly, just one not long ago, was like, 2 surgeons told me I needed a surgery. I wanted to do anything I could to avoid it. I started your program. Now I go many days without pain medication, and this feels like a miracle. So, it's like, this is a miracle. And so, the fact that we're able to bring things like this to really help people's lives and livelihoods is extremely powerful for all of us.
That's amazing and fantastic work that you're doing. You and your team, are doing here at the National Scoliosis Clinic. Just to, I guess, dive a little deeper as well on the financial impact for payers. How much do you expect could be saved within the system with this proper treatment for these patients achieving scale ultimately one day?
Yeah, so we've got some estimates that, it's north of like $400 million total. Now, the estimates of what can be saved depends on, our data of how, the resources that people use less of as they come through our program. So we're in the midst of collecting this data, but we're about to publish one study where we found that 1 of every 9 patients who comes through our program can potentially avoid a surgery. And so, if you eliminate 1 out of 9 surgeries times the number of people times the cost per surgery, this gets into like hundreds and hundreds of millions of dollars.
Absolutely.
But that's just kind of one aspect of the component. We're collecting data on, decreased use of other non-operative modalities such as standard physical therapy, pain medication, et cetera. And that's ongoing analysis that's happening.
You mentioned that you're achieving great results with your patients. This treatment is appearing to be transformative for this population of people, this 94% who are not good candidates with surgery, who are sent to pain management because there's nothing else that can be done. Standard physical therapy hasn't worked. Other medical therapies and interventions haven't worked. But this is working according to what you're seeing right now. And what I'm interested to know is, how are you all measuring that impact? Is it obviously the pain relief, but how are you measuring the pain and tracking improvements over time, so that way it's validated and you all can see tangible improvements in patient outcomes?
Yeah, that's a great point. So, I, having come up through the ranks of academic medicine and have published kind of hundreds of papers separately, I've got a background in clinical research, and so was very focused initially to make sure that we had mechanisms in place to collect data that at the end would be meaningful and validated and able to be compared to other things. And so when you look in the literature on treatment for scoliosis and back pain in general, whether it's surgery or non-operative treatment or anything, there are kind of standard and validated healthcare outcome questionnaires. So one is called the SRS-22, one is called the Oswestry Disability Index, and we use the EQ-5D. So these are, well-validated, kind of standard in the industry. So we use those. So we collect those data points, those questionnaires, on our patients. So when they start, and then every 30 days as they go on. And then so by doing that, we're able to compare apples to apples. The SRS-22 of our patients after 6 months compared to patients who just do physical therapy, we're able to compare head to head. And we've actually recently published that data showing that our members and patients do better than standard treatments.
We're in early innings right now, obviously, but things are looking extremely promising. Where do you see NSC going from here? What's your grand vision at scale where you can look and see that you've actually achieved the vision that you saw in your head years ago when you decided to found this company?
Yeah, so, we see within 5 years, our vision is to have the National Scoliosis Clinic be a household name for patients, for providers, not just surgeons, but other non-operative providers, and for payers. And so we want to be the universal solution that's accessible and affordable and effective for people everywhere and eventually all over the world. It's very possible nowadays with, the smartphone computer everybody has to deliver this kind of care far and wide reaching. So that's our goal. And we've got a lot of work to do. We've got to prove out our efficacy. We've just started building our kind of blocks of evidence. We've got to demonstrate to payers that we're saving them money. And we're also working towards that now to get payer coverage for our program. And then we need to get providers comfortable as well. Awareness, efficacy, trust, with a team that, they might not know. So these are some of the hurdles that we're preparing to clear, in the next few years. But it's a slow process and a long haul.
What do you need to be able to hit some of those milestones and hurdle some of those barriers?
Yeah, we really need members. We need patients and customers. Again, we've got 500. You can just imagine if we had 5,000 and we had data on those 5,000 when we can really granularly tell, what patients used for healthcare utilization prior, and then what the effect of our program is on all that. We just get much more compelling data with bigger numbers and longer outcome. And that's why a lot of it's just time. We just launched about 11 months ago or so, but it would help to have 1 year data, and so it's time and continuing to bring in new members and customers and continuing to talk to surgeons and healthcare systems and insurance companies.
Michael, I appreciate you taking the time to speak with me today. I'm extremely honored and privileged that I'm able to work with you, and you've allowed me the opportunity to speak with you today. You mentioned earlier that there are some trends that are taking place, obviously, with the rise of generative AI and large language models, and specifically a bunch of applications in the healthcare space. And as a decorated healthcare professional, I'm extremely curious to get your opinions and perspectives on some of the trends you're seeing in the healthcare space that are the most promising outside of what you're doing with the National Scoliosis Clinic.
Yeah, thanks. Thanks for that, AJ. And it's a pleasure to chat here as well. So yeah, big picture, it's an extremely exciting time to be, innovating in the health tech and digital health space. I alluded to some trends previously. We're seeing a lot of entrepreneurs work on solutions that personalize solutions to specific patients. And, there's a trend to get out of the standard brick and mortar settings where healthcare is delivered and think about innovative ways to deliver healthcare to a patient's home where it's more convenient for them. Obviously, we've got a lot of digital media with smartphones, and but Wi-Fi is pretty standard out there. Broadband is pretty standard, at least in the United States. And so those would be some key trends, I would say. Also, what's really exciting about being a founder is we're seeing a lot of AI tools that really help build and run companies. And so there's software that, if as I go through different things that I'm doing with the company, every pain point or task I do, I'm getting into the habit of I bet there's an AI tool that does this. And sure enough, 80% of things that you need to do, there's an AI software that will help with generating marketing creatives and, all the little tasks. And so the benefit is not only time, but, funding. And so you can run a company much more lean by doing some of these automations, that are driven by AI. And that's not unique to the healthcare space, of course. But, in the software and high tech startups kind of universally.
Okay. And then given that you're a surgeon, do you have any thoughts on, I guess, surgical applications of AI? For example, when it comes to robots or anything of that sort? I know that there's a couple of companies working on that now, kind of assisting surgery or being able to perform surgeries autonomously with robots. So I'm very curious if you have any thoughts on that.
Absolutely. So as far as intraoperative tools, or I should say perioperative tools, like around the surgical event, whether it's preoperative planning for that patient, intraoperative visualization, these are just kind of big categories, but intraoperative visualization of anatomy, and then intraoperative execution of technical, of technical events, and then postoperative recovery, patient care. So all of those four things are being innovated towards by big companies and by small companies. And there's going to be wholesale changes in all of those categories coming down the line. Robots is a big one. Like you mentioned, robots driven by AI visualization will just make that even more efficient and effective. And so we're seeing large med tech companies buy up a lot of small companies and build these platforms that are AI based and run the gamut of preoperative, intraoperative, and postoperative patient engagement, avoiding ER trips and evaluating postoperative wounds by computer vision. And so, you could list dozens and dozens of things, but it's changing fast. It's exciting to be at a place like Stanford where we're able to try and see some of this new technology before it becomes prime time. And so, so it's a fun time to be alive, I'd say.
That's amazing.
Yeah.
Well, again, thank you so much for speaking with me today, Michael. I wish you the best with National Scoliosis Clinic, and I'm looking forward to supporting you in the future and witnessing you build this platform into a household name.
Thank you so much. I really appreciate it.
Excellent.
Thanks.